more than a thumbnail, but I'll get started here. So welcome to our 5th session of COVID-19 Colorado and Beyond. This webinar is sponsored by the University of Colorado Denver's College of Liberal Arts and Sciences and its continuing and professional education and interdisciplinary studies programs. I'm Marjorie Levine Clark, and I'm a professor of history and associate dean for diversity, outreach, and initiatives in the college, and I'm the moderator for the series. Please use the Q&A feature at the bottom of your screen to ask questions during the lecture. We hope to get to as many of your questions as we can at the end of the presentation. Information about student credit and continuing education units can be found on our continuing and professional education website. Students interested in credit have to write a one-page paper for every lecture. And today's prompt for your paper is, would we expect lifting shelter-in-place orders to restart the economy? And I'll say that again. Would we expect lifting shelter-in-place orders to restart the economy? And this question will also be posted on the course website along with all the others. The lecture is also being recorded and it will be up on the website and the CLAS YouTube page as well. As usual, I want to thank all the people who made this webinar happen. First, Dean Pam Jansma and Assistant Dean Joanne Porter of the College of Liberal Arts and Sciences for supporting this program and making credit available to many of our students at no cost. Our outstanding faculty who volunteered their time for this series, Mike Effler and Noah Dodero from the Office of Information Technology, Shayna Bull, Amy Arnold, and the Office of Digital Education, Interim Associate Vice Chancellor of Academic Affairs, Joanne Brennan, the University Registrar, Carrie John, and her team, Associate Bursar, Eric Gray, and from CLAS, Tracy Combe, Director of Marketing and Communication, Laurel Dodds, Director of Continuing and Professional Education, Course and Curriculum Coordinator, Mary Lovett, and finally, Kristen Salisbury, Program Manager for Continuing and Professional Education, who oversaw putting this whole event together. Our lecturer today is Assistant Professor of Economics, Andrew Friedson. Professor Fritzen also holds a secondary appointment in the Department of Health Systems Management and Policy at the Colorado School of Public Health. His research includes recent work on measuring the public health benefits and economic costs of public policies aimed at combating the spread of COVID-19. He teaches courses on the economics of healthcare and public health at CU Denver and CU Anschutz. His lecture today is titled Trade-Offs Between Contagion Protection and the Economy. And I welcome Professor Friedson.
Oh, hi. Thank you so much for having me. I'm excited to talk to you all today. I'm going to have to apologize that I do have a pre-recorded lecture. This is in part because my house behind me, the Tivoli, now my actual house is a little bit of mess because we're in the process of moving. I can drop my virtual background for just a split second. This will be the one time I'll do it, and you can see that I'm literally living among boxes right now. So we're going to, so I have a recorded lecture, and then we'll take questions, and I'm really happy and excited to talk to you all about this. Hi, my name is Andrew Friedson. Welcome to Trade-Offs Between Contagion Protection and the Economy. Just a little bit about myself to explain kind of where I come at this whole area from. I'm an economist. I work in the area of healthcare economics, public policy economics, policy evaluation, and actually I've done a lot of research on laws that have been aimed at fighting COVID-19, and we'll talk a little bit about those today and how I've gone about evaluating them, how other economists would go about evaluating them, how a public health person would go about evaluating it. The idea here is that nothing is free, and we want to try to establish what you have to give up in order to get something. That way, when you are voting on representation, or if you are yourself, hi, welcome, glad you're listening, then you can get a sense of what the actual trade-offs are. So a big part of what I want to do first in this discussion is talk a bit about how we do these types of comparisons. So a little bit about what economics does, is I want to make a key distinction here between what is called positive science and normative science. Yeah, y'all didn't think we were going to get a full-on classroom experience here, but this is what we're going to get. Welcome to my laundry room lecture hall. So positive science is the idea that we're measuring what is. What are the facts on the ground? Normative science is, or normative decision-making, positive decision-making, is getting into what ought to be. So this is what is, so for example, I want to talk quite a bit today about shelter-in-place orders, which have been one of the frontline policies that states and cities have used to try to combat COVID-19. And a very normative way of thinking about this is, should we have shelter-in-place orders? And I don't want to answer that question. I don't think I'm the person to answer that question. I mean, maybe I am the person to answer that question, but I think that because we have a representative democracy, this is something that individuals need to decide as they choose their representation, and then the representation goes out and decides based on the facts on the ground what the right thing is. Or perhaps we have appointed public health officials who make these types of decisions. What I want to be focused on is not the question of shelter-in-place order, but the question of how many lives does a shelter-in-place order save? Cases of COVID-19 does a shelter-in-place order avoid? How many jobs does a shelter-in-place order cost us? And then once we can get a sense of these trade-offs, for example, a shelter-in-place order is going to save, 2,000 cases of COVID a week, and it's going to cost us 1,000 jobs a week, something like that, right? Then you can get in there with your own personal ideals, morals, what have you, and say, I am comfortable with this policy, or I am not comfortable with this policy. And then the democracy or the representation or the central decision maker can then decide. But if we don't have a clear sense of what the facts on the ground are, then we're just playing Calvin ball, right? We're just making up numbers and making decisions based on what we think feels right. And this is what we really want to try to avoid. So what I want to build towards in this short time that we are together is the basics of how we as economists or policy researchers or even many public health researchers go about measuring these types of things. What are the benefits of a policy and what are the costs of a policy? And we're going to do today what's called benefit cost analysis. And benefit cost analysis is essentially a fancy way of doing a just pro-con list. I'm going to list out all of the benefits of a policy, and I'm going to list out all the costs of a policy. And if we decide that we value the benefits more than we value the costs, then the policy is going to be a good one and we're going to want to do it. If we're going to say, no, the costs are too high, then we're not going to want to do it. The important thing to understand is that some of these benefits and some of these costs are going to be very concrete, that we can put a number on them. Some of them are going to be a little bit softer, right, in terms of how unhappy it makes someone, or physical discomfort. That's something that's difficult to put a dollar on. It's not impossible to put a dollar on, but maybe it's something you don't want to. It's also a question of who feels the benefits, who feels the costs. So I guess the point is that I'm trying to make here is that just because we do a benefit cost analysis and it may look like many of the benefits outweigh many of the costs, doesn't mean that that is going to be the same for every single person, that there is room for some variation in opinion here with regards to individual morality, individual, that these things bite on an individual. Let's dig into it a little bit more. Okay, so let's think a bit about something that we're probably all very familiar with right now. Let's talk about some of the policies that we've been using to fight COVID-19. And we can just look at some of the benefits and some of the costs of some of these policies. And the one I'm going to focus on today, and we'll use it kind of as our model, is the shelter in place order, which we can abbreviate as just SIPO, right? So we've all become very well acclimated with the shelter in place order, right? That if you are non-essential, like myself, you stay home. And if you are essential, my wife, who is an intensive care nurse, you go out and you work. And there's certain exceptions why you're allowed to leave your home. You can leave your home to purchase food, purchase medicine, to care for a sick relative. These vary a little bit from state to state. In Colorado, you can go exercise. In other states, you can't. So we can start to stack up what the benefits and costs are, right? So one benefit of a shelter-in-place order is it's going to slow the spread of COVID-19, right? That's the whole point, the whole reason why we did this. Now, this is a little bit soft, right? Slow the spread. Well, how much are we going to slow the spread? There's a few different dimensions along which you may be slowing the spread, right? You may, there may be some benefits from prevent cases, prevent deaths, right? So there's some benefit to you don't get sick, you don't die. There's also a benefit perhaps to delaying cases, right? This was the whole argument at the beginning of flatten the curve, right? The idea is that when you look at an epidemic over time, if this is time and this is cases, and I should say active cases, that it looks like this, right? That you have a peak and then you have a down thing. And the general idea of flattening the curve is that you have some capacity in your healthcare system. Say it's here, and once you go above here, people start dying a lot faster because you don't have enough ventilators, you don't have enough hospital beds, you don't have enough masks, PPE for the healthcare workers. And so the idea is that if we can spread this curve out, maybe the time period and the extent to which we're over our capacity is lower. And by delaying some cases and not even preventing them, we may prevent a number of deaths, right? So these are the main arguments for why we want to do a shelter-in-place order. But there are some costs to a shelter-in-place order, right? We're going to, in addition to slowing the spread of COVID-19, we may also slow the economy. Right? One of the things that we do when we are sheltering and shutting down businesses, right, is that people work at these places. People make money from these places, right? So we're going to close businesses. One thing that we're starting to feel now, right, is we're going to have less tax revenue. Anytime you go out and spend money somewhere, some of that goes into sales tax, and that sales tax goes to the state or the city, depending on where you are and how much of it is. Yeah, we're going to get into the ins and outs of taxation here. The important thing is that then the government turns around and spends it on things that we want and employs people, right? I'm employed by the government. So when you have less tax revenue, you have less for the government to spend, and you cannot pay your workers. And many government workers may have to take fired, just like private sector workers. Okay, so Slow the spread of COVID, slow the economy. There's another thing. You're stuck at home. And there's a lot of variation with how much being stuck at home is a cost. For some people, being stuck at home is awesome. It's, man, now I have all the time I wanted to play video games that I did not have before. And this is actually a pretty sweet deal. For other people, maybe being stuck at home for weeks and weeks and weeks on end with, for example, a 2-year-old and a 5-year-old who cannot go to school and are bouncing off the walls may wear on you a little bit, may cause you to go gray a little bit faster than you had thought that you were going to. I don't know who this could be about, but it's entirely possible that some people may go a little stir crazy, right? So not being able to go out and enjoy restaurants and all these types of things could be quite costly for some and for the other, less so for the others. So hopefully one of the things that you're starting to see is that some of these things we can perhaps put some pretty solid numbers on, right? Perhaps we're going to be able to estimate pretty nicely how much shelter-in-place orders have slowed COVID-19. And perhaps we're going to be able to measure nicely how much has slowed the economy. And we can get a nice number for benefits to society here, cost to society here, and then perhaps whether you, if these things are close, your personal opinion as to whether you think sheltering is a good thing or not may actually hinge on something like this, right? Okay. One last thing to point out before we start, well, a few things to point out. One thing I want to point out is that and you may have started to get a sense of this already. Benefits and costs need not fall equally. Policies can have what are called winners and losers. The idea here is that any policy that you have, if I'm going to do a cost-benefit analysis, for example, at the state level, and say, okay, what are all the benefits to the population of the state? What are all the costs to the population of the state? And we say, oh, wow, for shelter in place, again, I'm not saying this is necessarily the case, but for shelter in place, for example, let's say that for the state, the benefits far outweigh the cost. That doesn't mean that the benefits are going to outweigh the cost for every single person in the state. There are going to be some people who are going to win, some people who are going to lose, and some people, they may just break even. I mean, there's some very clear winners from shelter-in-place laws. These are people who, for example, are immunocompromised and for whom there's a very high cost if they get infected, right? Losers, perhaps, maybe if I'm a young 20-something who wants to be out at the bars. You've closed all my bars. I want to get drunk, man. Unfortunately, the cost is quite low, and I'm going to lose out when this policy comes in. And that's part of the process, right? Is that when we make these decisions, we're trying to make them for an entire society, and that doesn't mean that everybody in the society falls within the same cookie cutter. Okay. This is actually a rather nice lead-in to another really important idea, which is something I've heard a lot when talking about COVID-19 is that, well, will people just do the right thing anyway, right? They're going to see the virus is out there and they're going to say, okay, it's time to shelter. And many people did see the virus and many people did shelter in place. And one argument I want to make is that if you leave people to their own devices, you're going to see some appropriate behavior, but you're never going to see enough. For masks, this could be for sheltering in place behavior. Heck, this could be for washing your hands. This is true for many types of contagion behavior. And this is because contagion behavior falls under a very classic problem in economics. And then I promise we'll talk a little bit about estimating the actual costs of COVID-19. What I want to talk about very briefly is the idea of an externality, or what are called externalities. These are sometimes called spillovers. And it's when a decision impacts someone who is not part of the decision process. I guess I should really make the point. I'm not social decisions like should we have a shelter-in-place order or not. What I'm really referring to by decisions is I'm making the point that this is an individual decision. So one person, firm, one household, something like that. And so we typically put these things in two buckets. One's called positive. I know I used the term positive already. Positive externality. There's some extra good. And something called a negative externality, where there's some extra bad. And the issue is that people tend to be quite good at counting up their own personal costs and benefits, but are not very good at getting an accurate estimation or caring at all, frankly, about benefits or costs that they impose on others. Okay, so just to give some quick examples of this, right? We could talk very classic externality problems within health economics or economics in general. You can think about smoking, right? What an economist is going to tell you about smoking is that there's benefits and costs. So it's bad for you. I don't think that's controversial these days to say smoking's bad for you. And benefits, I may like it. So maybe I like cigarettes. Now this is abstracting away from the issue of, well, maybe I'm addicted or something like that, right? But if you're talking to a very classic economist, right? They're going to say, well, you've got some benefits to smoking, you like it, and you've got some costs. And if you personally think that the benefits outweigh the cost, then go for it, like have fun. They'll say that about any type of drug. If you can accurately get a sense of how bad cocaine or heroin is going to be for you and you like it, go for it, right? That's a very University of Chicago laissez-faire economics way of thinking. I'm not saying that's necessarily how I think about these things, but this is kind of the classic economic theory on this. Unfortunately, there's this additional thing where it's bad for others that are around you. And the idea is that if I'm making a decision as to my benefits and my costs, I'm going to do a really bad job accounting this. And that maybe what's good for society is to have a lot less smoking because people, when they're left to their own devices, will count this and this, but will neglect this. And so they're going to choose to do too much because the benefits may outweigh these costs, but they may not always outweigh this cost plus this cost. This is, by the way, one of the main reasons why we smoke, why we tax cigarettes, or why we, is that we're trying to correct this. We're trying to get people, the idea is you're trying to set the tax to be the cost on others. There you go, you've now taken 30% of a course in public economics, right? You can also have situations that are a little bit close to our sheltering in place behavior, our social distancing behavior, right? Another classic one that we like to talk about in economics is vaccines, right? Costs, there's the price, of the vaccine. Oh, I guess I should have put the price of cigarettes. You actually have to pay money to buy them. You don't just grow on cigarette trees. There's the cost of the vaccine. You've got perhaps a copay, or you have to pay out of pocket, out of your pocket if you don't have insurance. There's also, maybe it hurts, right? I mean, flu shot hurts. My arm hurts for like a day. That's not nothing. But the benefit is immunity, right? So I get immunity. That's my benefit of getting vaccinated. And the cost is I got to pay for the vaccine, and it hurts a little bit, right? How much do I value immunity is going to depend a little bit on like how much I worry about getting sick and how many people I could potentially get sick from. The benefit, which is I can't get others sick. So when I get a vaccine, the risk for everybody else who's not vaccinated drops just a little bit. And if everyone gets a vaccine, it can drop pretty close to zero. That's what's called herd immunity. So when I'm looking at my own personal benefits and costs, I'm going to trade off this against these, and I'm not going to do a very good job of counting this. I mean, sometimes you could think about like, well, I'm having a kid, so I got to get my vaccine because the baby's not protected. But how often are you actually thinking about like everybody else's baby? Your flu shot, if you're getting a flu shot this year, or you got a flu shot this year, how often are you getting a flu shot and thinking about, man, there's someone in a cancer ward somewhere who's immunocompromised, and I'm just pushing their risk down like a little bit. Man, that feels good. I don't think that, right? And I tend to underdo it. And this is going to be the case for shelter-in-place behaviors or any type of social distancing, right? So social distancing. Or, any of these things like wearing a mask in public, stuff like that, right? Benefits. I am less at risk. Costs. It sucks, right? Yeah, I don't want to be socially distanced. I want to go out and do some things, but I'm less at risk. However, there's also others are less at risk. And even if I am somewhat altruistic and do value this, I'm never going to be quite good enough at getting the true sense of this. People are always going to undervalue this or value it at zero. And so they're never going to do quite enough distancing behavior, although they may do some. So let's look at the data, because I do want to make the point that even without a shelter-in-place law, you are going to see some social distancing behavior, because we could break social distancing into a lot of different activities. There's like going outside, there's sending kids to school, there's going out to restaurants. Like I may feel differently about different types of behaviors based on how exposed or how at risk I'm going to feel, right? So let me show you some data. And for an example, I'm going to show you the state of California. And what I want to show you is data from Opentable. So many of you may have used Opentable. This is a website that lets you reserve at restaurants, right? And here we go. So let me explain a little bit about what's going on here. These are dates, right? I haven't put actual like dots here. I've connected all the dots. And then this is the percent change from the previous year. So March 1st, 2020, relative to March 1st, 2019, it's about 1 or 2% less than what it was the previous year. And as March is going on, all of a sudden, the percent change in reservations just drops off a cliff in California. And it pushes almost completely to zero. And then March 19th is the day that California put a statewide shelter-in-place order. They were the first state to have a shelter-in-place order. And so what you can see is some sheltering behavior before California even used their shelter-in-place law. So one thing that you could say is, well, do shelter-in-place laws even matter, right? If I'm going to put an order on people, that's a joke. That's a restaurant joke with Opentable. It's not. If I'm going to put an order on people that's going to force them home, is it going to be doing much over and above what was already happening? I mean, you can ask this in reverse too, right? If you lift a shelter-in-place order, and we've seen this in many states, right? Does that mean that the economy comes roaring back? Well, not if people aren't comfortable being part of the economy. But one thing that we can think about is, again, when we were dealing with this individual cost benefit, as I have already erased my board, when we're dealing with the individual cost benefit analysis for different types of sheltering behavior, that have these positive externalities associated with them, there's going to be a continuum of people. Maybe everyone's going to stop going out to restaurants, maybe not, right? Certainly the people who used Opentable in California did. But there may be other types of social distancing behavior going to work, putting your kids in school, having a beer with your neighbors, that people are going to feel a bit more comfortable doing, or that a certain percentage of people will feel comfortable doing without an order. So we could have the risk of COVID-19 and the perceived risk of COVID-19 just totally shoot up through the roof. And more people are going to choose to social distance. And what a shelter-in-place order does is says there's always going to be some non-compliers. And what we are doing now is putting the full force of the law behind social distancing and forcing those non-compliers, that last little bit of people, to follow along. And that kind of changes the benefit calculation, right? If a lot of the social distancing is coming without using a shelter-in-place order, maybe a lot of the benefit is not part of the shelter-in-place order at all. We could even say the same about the economic cost, right? A shelter-in-place order might have a big economic cost, or it might not. It might just be shutting down those last couple businesses that weren't shutting down on their own. So what I want to do now is show you some data that I've used. Interesting. Okay, so what I want to do now is show you some. Hold on one second. Am I recording? All right, so what I want to do now is show you some data. And what we have here is cell phone data. I know, it's a little scary to think that I have your cell phone, but I don't. What I have here is anonymous cell phone data, right? So what's going on here is there's this company called SafeGraph, which collects cell phone tower pings. And what they're doing is they're assigning every cell phone, they don't know whose cell phone it is, essentially a 100-meter square, right? It's actually 153 by 153. And then what they're doing is asking the question, when a cell phone pings overnight, where does it ping most often? What square does it ping most often in? And that, they said, is your home. They did this back in like February. And then what they're saying is in March and going forward, what percentage of phones only ping for a given day within their home, never leave home? So this is complete sheltering in place. So again, I don't know anything about any of the individuals. I just know the count of phones or the percent of phones within California that are never leaving their home. And what you can see is that, again, here I've marked the day that the shelter in place order comes. People start sheltering in place well before the order comes into play. And then it continues to go up and then it levels off and we get around 25% finally of people that stay home all day on any given day. Now, again, this is not the only dimension for sheltering in place, but it's a valuable one to think about. So what's the problem here? Is that I have no idea what this line was going to look like if we didn't have a shelter in place order. And this is the big issue when you're trying to do policy evaluation. Is you're always asking, what is what we call the counterfactual? Or what would have happened if we didn't do the thing that we did, if we did not have the policy? And this is a little bit of a tricky question to answer. And this is really what I do for a living. and what a lot of economists who do applied empirical work do, is try to construct counterfactuals. And so I'm going to show you some results from a few different papers I've written that have tried to answer this question of what did these policies actually do? And to do this, really what we're answering is this question of what is the counterfactual? Not counterfactual, counter, pretend that's an R. Okay, so let me show you a bit more data. Let's go back to this picture. So one thing that we can do is I can say, well, at this time, California is the very first state to turn on shelter-in-place order, but there's a lot of states that hadn't done so yet. And so what I can do is try to match states to California that look similar, I think you can see my mouse, in this period right here. So what I want to do is I'm going to take an average of states, what's called a weighted average, to try to match this as closely as possible, to say, okay, on what states before the policy came into play can we make this weighted average look as much like California as possible? And then we'll let that weighted average of states run, follow those states onward and see, well, do they lay on top? And then maybe the shelter-in-place order had no effect. Do they go below? In which case, maybe the shelter-in-place order did. Do they go above? Maybe it did. Right, and we can do, then you get into all these fights with other economists about what's the right way to match. And in this paper that we did it, we matched about 40 different ways. And I'm going to show you one picture, and I'm going to tell you that if you can go look up this piece of research, you will find that we can do this with 40 different ways of matching, and they're all pretty much the identical picture. And the picture looks like this, where when we match in the pre-period, we get states that pretty much look like California in terms of sheltering in place. And then once the policy comes into play, actual California is going to shelter in place a bit more than the counterfactual did. So it's saying that, look, all of the sheltering behavior that we're observing is not due to the policy, but there is some, this gap, there is some. And we can do the same exercise with COVID-19 cases. Right, here we go. Here's the case data. This is taken from the CDC in California. And when we follow a weighted average of states to get them to match as closely as possible to California, we find that cases would have been quite a bit larger. We can do the same thing with deaths. You'll notice what's really interesting here is that cases don't start to diverge, at least for a couple days, because your testing is who got infected a few days ago. So these days here are going to have very little difference because they're reflecting infections that happened on this day, because it takes about 5 days to have symptoms. Likewise, it takes about a larger number of days for deaths, because it takes a while to die if you have a severe case of COVID. And so you'll see that they stay together for a little bit longer, and then the weighted average of states that looked similar to California in terms of deaths starts trending up tremendously faster than actual California. So we can count this up. And what we found from these studies, oh, actually, let me show you one more before we do that. I forgot I had this one too. Another way that I can do this, ooh, this is gonna be a little confusing. Maybe not. Another way that we can do this is, rather than taking a weighted average of states, is I can just look at every single state based on when they turn on and off and just plot them out. And so these are days before, and this is the difference between states that have a shelter-in-place order and states that don't have a shelter-in-place order. So now I'm just going to take all states, line them up based on the day that the state first had a shelter-in-place order, and look at what happens. So the difference between a shelter-in-place order state and a non-shelter-in-place order state, so this is just a different way of doing the counterfactual. But we're going to find a very similar story. There's almost zero difference between the two types of states prior to the shelter-in-place order, and then post-shelter-in-place order. The difference in the states is going to get bigger. So this is actually the same picture, right? What I'm showing here is that what I'm plotting is the difference between the lines, right? And so here there's zero difference between the lines. Then we get a bigger difference, and then it kind of levels out and goes down maybe a bit. And here we've got zero difference between the lines, and then it gets much bigger and levels out. And you can see it's only about 2% more. It's not a huge amount that we're getting. This is COVID cases. So you can see there's zero difference between shelter-in-place states and non-shelter-in-place states in terms of before the orders. And then once you have a shelter-in-place order, relative to the states that didn't have a shelter-in-place order, you start declining. Oh, and that's all I want to show you on these. Right, so if I'm going to sum up kind of what these study results mean, right, what we found is shelter-in-place order, that you have about a 10% increase in staying at home. Right, it was about 2 percentage points off of about 20% of people staying home, so that's a 10% increase. Right. You also saw about a 44% reduction in case growth. So if we're going to talk about over a time frame, so over 4 weeks, what our study found was we're dealing with about 125,000, not 12, 125, 125,000 fewer cases of COVID-19. Now, we're not the only study that's tried to estimate this. I will say that we actually end up being one of the more conservative studies. There's another study published in a journal called Health Affairs that used county level orders, and they found shelter-in-place orders to be about 10 times bigger in terms of the effects. I stand by my work, but there is some range in terms of what people estimate doing these things. So yeah, this is what we would plug in on our benefit side, right? So we can go all the way back to where we started, right? And we can talk about benefits again. And costs. And over 4 weeks, we're dealing with about 125,000 fewer cases. Okay, so we've got some cases averted. So then the question is, what about costs? And so we can do very similar types of analyses where we look at states that have the policy, states that don't have the policy that are similar, see if they look the same before the policy, and then see if they change after the policy. And I didn't write these studies. There are two different teams. There's a team at Berkeley and they looked at UI claims, unemployment insurance claims. And they found that a CPO was about, where's the exact number? Yeah, so if you compare them with our cases, that you're going to get about 32 claims per case averted. Right, so you can line them up with our number and you can get exactly what the trade-off is. Perfect. Right, and now you have a sense of what is, so they ended up a couple million claims per week. Oh, sorry, it was about 4 million UI claims over on the same time period. All right, so we've got our trade-off, right? 32 claims per case averted. Right, and then on top of this, we've got, so this is, let me try writing this out a little bit differently. So one case of COVID-19 prevented is going to be about 32 UI claims, right? And that's the trade-off that we can make. And now my job as an economist is done, and I can hand this off to our policymakers and to you, the public, to now say, is this a trade-off that we think is worth it? I can't answer that for you, right? Now there's some additional costs that are going to accrue to you, right? Well, are you likely to be that case of COVID, right? How bad would it be if you're the one who catches it? How bad is it if you're someone who's likely to lose your job? You're going to feel a little bit differently. Also, there's those costs of sheltering in place. Now, there's a few more things that we can do, right? Once we kind of can get these trade-offs, is we can start looking at other types of policies and say, okay, if this is 1 to 32 UI claims, are there other types of policies that are going to have bigger returns for a lower cost? Maybe there's some lower hanging fruit. And as it turns out, there is. So one of the cool things that you can do with cost benefit analysis is you can line up different policies and compare their trade-offs. Right? Maybe I'm willing to make that trade-off for a shelter-in-place order. Maybe I'm not. But maybe there's a lower cost trade-off that more people are willing to do that are going to be more popular. And if you can figure out what these trade-offs are, you can then pick the lowest hanging fruit first. So I'll give you 3 examples. There's actually been some really nice recent studies. One is mask ordinances. So the cost of wearing a mask in public is the cost of buying a mask and the discomfort of wearing a mask and feeling silly and maybe your ears hurt and all these different things. One of my friends was saying in 2019, it was nice dress. Oh yeah, it has pockets. And in 2020, it's nice mask. Oh yeah, it has soft elastic, doesn't hurt my ears. Mask ordinances have been about a 1 to 2% decrease in cases. I should say in case growth. So this is not terribly different from shelter-in-place orders. I mean, we were finding about 44%, so it's a much smaller thing, I should say. But you're getting some bang for very little buck. It's not costing you a lot. Another thing you can do is school schedules. There's a really cool paper that looked at spring break and looked at schools, colleges that had early spring breaks where the students went out, did spring break, and then came back. And then as many of you may know, many colleges went online. And so if you had a later spring break, many students went out. For example, here at CU Denver, they went out and then they never came back. Classes went completely online, actually the week before spring break. But if you had an early spring break, you went out and you came back. So early spring break, really cool study found about 4% faster case growth in college towns that had early spring break. So one easy policy that you can do is, for example, what University of Notre Dame is doing, where what they've done with their school schedule is they've started their fall semester, or they're going to start their fall semester. Again, this is for schools that choose to meet in person. They're starting it 2 weeks early. And then they're not doing Thanksgiving break. The semester ends before Thanksgiving, right before Thanksgiving, and that's the end of the semester and everyone just goes home. So there's no situation where students go out, spread things or pick up things and then come back. They're trying to limit mixing. Another thing that I've studied personally is what's called a targeted SIPO. And this is really cool. This is what happened unintentionally in Texas, is that Texas did not have a statewide SIPO right away. What they did is they let counties and cities decide for themselves. And so you had some counties and cities that started early, some counties and cities that started late, and you can compare them. And what we found in that study is that 90% of the benefit of any shelter-in-place order in the entire state came from highly urbanized locations that went early. So it's saying that, well, because the way infections work, right, that you have to be able to, or sorry, contagion works, I have to be close to someone else. And as you have a more densely packed population, you're more commonly close to one another. That if I target shelter-in-place orders only at the cities, then I'm going to get 90% of the benefit, and I can avoid having any of the costs to shutting down businesses in less populated areas. All right, so hopefully what we've done here is giving you a sense of how you can measure the costs and benefits of different types of policies and what we know, at least first wave of research on shelter-in-place orders. And now I will magically appear live to take some questions.
Okay.
I'm back.
All right. I'm here too. Can you see me?
Yeah.
Okay, great. So that was great. I learned a lot.
I apologize for all the difficult technology.
I apologize for the technical difficulties. You know, you never know. So I have a great first question. How often is a cost-benefit analysis revised? We can always enter some decisions thinking if we know what the costs and benefits are, but then once policy is implemented, it's changed. What have been some of the unforeseen costs and perhaps even benefits of the COVID-19 pandemic?
Yeah, I mean, cost-benefit analyses ideally get updated quite rapidly. And it depends on, you know, the type of policy that you're evaluating and the importance of the policy you're evaluating and what your in some cases, what your policy evaluation team is like, right? That if you have a really important question, like how to deal with the COVID pandemic, you're ideally updating these things with new information as that new information comes available, right? I mean, a great example of this is the mask policies, right? That early on, the CDC was giving advice that, no, masks aren't really doing much and we don't think that this is important. And man, we're in a very different place now. And states have changed their cost-benefit analyses and have changed their policies as that has happened. Likewise, when you're talking about states wanting to reopen, effectively what they're doing is changing their cost-benefit analysis on the policy based on the facts on the ground, right? They're saying, what are the number of cases? What do we think is the reproduction rate of the disease at the moment? That's how often is it doubling or within the population? And then you can ask questions like, okay, at what point do we think that the cost benefit analysis will make it so that it's worthwhile to reopen, right? So for these types of policies, this is getting updated daily as new information gets available, it becomes available.
And I'm not sure if this came from the same person, but somebody said in terms of California Opentable data, the Bay Area put out a shelter-in-place order before the state.
Yeah, Sacramento did too. There were several cities in the paper that in the Opentable data. I did not clean that out, but the other pictures we've actually removed those cities because they're contaminated for closing earlier. And we actually have done separate analyses. You sound like the people evaluating my research. We've done separate evaluations of those cities specifically, and you find similar patterns that you can look at that city and see when it closes and what happens, and you see the same exact pattern within a city as opposed to within a state.
Okay, cool. Has anyone looked at mental health costs of shelter in place?
Yes. I've seen I actually peer reviewed a paper on that topic. But yes, it's out there. You'll have to fire up Google Scholar or Medline or something like that to try to find the specific study. I don't remember. As someone working on COVID, and that there's a lot of research coming out on COVID within the public policy realm at the moment, my inbox has been flooded with requests to peer review research at the moment.
And I think we have a lecture. Sorry, I think we have a lecture from Kristen Kilborn coming up in a couple of weeks that's going to deal with some of those issues, not specifically shelter in place, I think, but more broadly.
I can tell you from a personal perspective that, yeah, I mean, my mental health has not been great.
Right. Exactly. Right. I think we're all kind of feeling that way. Yes. An interesting question. What has happened in Sweden without the shelter-in-place order?
I'm not going to comment on Sweden. I think that, so why do I not want to comment on Sweden? I'll be honest, I've been really hyper-focused on the United States, and I'm not abreast of what's going on in Sweden. That anything I'm going to say is just going to be shooting from the hip, and I don't think that that does well to elevate the discussion. And it's important to be able to admit when you do not have expertise in an area, and then to not comment. And so I just have not been following Sweden terribly closely, and yeah, I don't want to go down a rabbit hole that I'm not going to be able to give a good answer on.
Agreed. Do you feel like your research is being listened to by policymakers?
It depends on the policymaker. Yeah, man, I have never had so much empathy for the scientists in disaster movies as I do these days. Yeah, I think that some of the science is being listened to. I mean, there's certainly been some news coverage of the work that's been going on, and it's you know, some of my colleagues who have had other studies published have certainly, there's a team at the University of Kentucky that put out a big paper on shelter in place as well. And they talked to the governor and things like that. So Polis, if you're listening, I'm happy to chat with you. Yeah, I think it's getting perhaps not the attention that I think it should be.
No. Well, maybe you could speak.
But I think that about all of my research. I think that all of my
Everybody
research
does.
is straight to the State House. So
Right.
Perhaps this time more than others.
But we were talking a little bit before the webinar started about this new paper you've done. That is.
Oh yeah, no, this one has caught fire that I've been doing some work on.
That.
Yeah, I've been, so the team that's been working on this, which includes some researchers at Bentley University and San Diego State University. I should not make it sound like it's a one-man show. We have an army of research assistants helping with this data. We've been looking at the Black Lives Matter protests because there's been a lot of conversation about how, you know, if you're doing this during a pandemic, that there's a lot of potential for contagion at these events. And so what we've been doing is looking at cities that have these protests versus cities that didn't have the protests on a given day, and following the same cell phone data. And the interesting thing that we've been observing is that in the cities that have been having these protests, the shelter in place measures are going up. And it's because, or at least we think it's because, and we've added a few different types of distancing measures to the thing to kind of keep track of this. So it's not just, are you staying at home all day? It's also, how many hours do we see you at home? Things like that. And what we think what's happening is that there's avoidance behavior from people who are not part of the protest, the non-protest attendees, whether it's because, you know, they're worried about COVID, they're worried about fear of violence at the protests because there have been reports of violence. For example, I don't want to get hit by a rubber bullet. And then there's also, maybe there's traffic, maybe I just don't want to deal with the traffic, right? You can't rule out these minor inconveniences as well. And then when you follow the case growth patterns for cities that had protests versus those that didn't, it's the same, right? That these protests don't appear to be driving a differential change in COVID cases. Perhaps our story is because of this offsetting behavior. You know, the protesters, or may be 20,000 people in a huge protest, but this is happening in cities of, you know, 2, 3, 5 million, right? And if you've got the rest of the city actually sheltering in place, yes, you can get sick at a protest. You can also get sick at the grocery store. That these things may offset. I'm not saying that protesting is a safe behavior. I'm not saying that protesters aren't spreading the disease. I don't have any data on that. What I am saying is that at a population level, it's been super interesting to see that it's not any different. And it's, in those cities, the overall population seems to be sheltering more, which I found super interesting.
And you are getting some attention.
Yeah, that's getting a lot of media attention because that one's super, it's double topical. So that's been in like Newsweek and BuzzFeed News and you know, all these big places.
So that's exciting. No.
Yeah, I know someone listened to that one.
Yeah. Okay, another question. Could COVID-19 running rampant, unchecked, also have an adverse effect on the economy in the long run too? Um,
Oh yeah, absolutely.
so
Um,
if hospitals are overrun with people, that might cost a lot for the government to cover and for health insurance companies.
yeah, no, there's short run costs and there's long run costs. I don't think that um, we really have a good sense of how difficult. I mean, one of the big questions in economics has been what's the shape of the recovery to the COVID recession going to look like, right? It's the sense of we've got this upward trend in economic growth, and is it going to be a Z where you zip down and then you zip back up? Is it going to be a U? Kind of how long is it going to take? And everyone is trying to look at early indicators to get a sense of what the recovery trajectory is going to look like. Because if you look at the Great Recession, man, it was slow. That certain things like employment caught up a little bit more quickly, and wages really haven't. I mean, in Colorado, we've been very lucky, and we've had a period of really amazing wage growth over the last couple years relative to the rest of the country. But that doesn't necessarily mean that that's going to happen this time. Yeah. So yeah, we economists are very worried about this.
Is there any comment you'd like to make on how COVID has exposed some of the institutional flaws, specifically economically, in the US?
Boy, that's a big, big question. It's a little off topic from this lecture, which is more about policy analysis, but I think it links back to the idea of winners and losers, right? And this idea of when you're talking on net about what's right for, you know, an entire population on average, you miss these effects of what's happening to subgroups. And there's been some really, really good work in the last couple of years. If you're looking for there's this economist at Stanford. His name is Raj, R-A-J Chetty, C-H-E-T-T-Y. He's done some really fantastic work on initial conditions, kind of like what's the income, the social class that you're born into, and then what happens with your life expectancy and how likely are you to escape that, you know, what's the mobility available. And we've known for a long time in health economics that, for example, income is a big predictor of health outcomes. So I think absolutely that when you have a large health shock and large economic shock hitting at the same time, it's making it very apparent that we have quite an unequal system. And I think there's no question that this has shown a light on that. This is something that just in the last decade, economists have made a lot of headway on kind of identifying many of the pathways through which inequality is affecting intergenerational and throughout the course of a single life cycle, health outcomes, wealth outcomes, upward mobility, things like that. So this is, yeah, I think it's a big deal. But I'm going to leave it at that and say, yes, I agree. It's a big problem. There's a lot there. But that is, man, a whole nother lecture, if not a whole nother lecture series.
Yeah. So I was curious with your, the shelter in place where the one case of COVID-19 prevented equals 32 unemployment insurance claims, if that were framed, and, you know, and maybe you can't do this in terms of deaths.
So let's be very careful. Yeah, this is for the first
First
few
4 weeks. 4
Yeah,
weeks.
for the first
Right.
4 weeks, because
Right.
over time, right, these numbers change, right? There's a
Right.
trajectory of the disease, and that's the idea. And actually, I do have the deaths number. Let me pull it up. Because we did
I'm
that
thinking
calculation.
like in terms of cost benefit analysis, you know, if you're trying to get people to shelter in place and you frame it in terms of death rather than cases, you know.
No, that's right.
Yeah.
I have the case. I have the death number as well that we calculate. I just have to pull it up. It's different. It's slightly different in different papers, but let me. I apologize for not having that.
That's okay.
In my back pocket. All right, well, while that opens, I can come back with that number.
Sure. So Do you want me to ask another question while
Yeah,
you're?
please, and I'll try to find that number for you.
I'm curious if there's economic work being done to cost benefit analyze the impact stay-at-home orders may have on other health conditions that are not COVID-19 but may not be treated with the shutdown of certain medical facilities. I was thinking
Yeah, so
of preventative medicine, et cetera.
yes, there's a few different things going on here. And this is something that the data is just not out yet. And it's something that, for example, some of my graduate students, I have a PhD student who's actually started working on this type of stuff, that this is going to be like her dissertation. So stay tuned because she's gonna do some good stuff. Okay, so first, for cases averted, job losses per life saved, we're looking at about 150, right? There's some bands on this, but it's about 150 on insurance claims or about job losses to, again, one of the big things that we're not entirely sure about is how long are these jobs lost? And this is a life saved for these couple of months. Is this a case that was stopped forever, or is this a case that is prevented? Now, with regards to shelter in place, one of the things that happened is that hospitals stopped doing elective procedures, people stopped having in-person care, things like that. And the question is, what is this going to do in the long run, or even in the medium run, with regards to different types of outcomes, right? And this is absolutely something that you can talk about what you think is going to happen, right? For example, you can say, well, I can't have in-person care, so the quality of care is going to go down, or I can't have certain types of elective procedures, and maybe delaying is going to be costly down the road. And so these are going to be costs. These are very difficult to estimate because it hasn't happened yet, right? So we can put some guesses on them and can put some bands on them, but and this is things that like the state budget office or the congressional budget office might do, but we just don't have numbers for these yet. Another interesting side effect is that, and this is just anecdotal because my wife works at the children's hospital, is that many types of illnesses and injuries as well are down because of sheltering in place, right? So sheltering in place prevents COVID from spreading, but it also prevents the flu from spreading. It also prevents other types of respiratory illnesses from spreading. And so the caseload, for example, in the intensive care unit, the children's hospital, because recall, COVID does not affect children very strongly, the place is almost empty, or was almost empty at the start of lockdown, right? Because the main things that put kids in the intensive care unit are surgery recovery. Those surgeries weren't happening unless it was an emergency. Certain types of severe illnesses, many of which are communicable, and major accidents like boating accidents, car accidents, ski accidents. Well, no one's driving anywhere. No one's skiing. No one's out on boats, right? So these offsetting effects in other parts of the healthcare system, it's not just, well, we're missing preventative care. It's also, there's a lot of other type of illnesses that shelter in place may also fight. We just don't have shelter in place for, annual respiratory viruses.
Right. That's really interesting. That's not something I thought of. So I think we have time for one more question. How often do you use other countries as a point of comparison for policy recommendations? Was it helpful for your research that many EU countries had outbreaks before the US?
So the answer is some economists use a lot of EU data. I'm not someone who does. I typically focus on US policy. I think it's just a question of what you specialize in. I came up before I went and got my PhD, I worked in a state budget office. So I focus mainly on trying to figure out how we've messed up our own country as opposed to looking at how other people have messed up theirs. Yeah, I'm not going to say that that's not an important point of comparison. I'm just going to say that for the moment, at this point in my career, it's a little bit above my pay grade to be making these big, well, here's this model, here's that model, here's that model. I'm very much in the side of, okay, we've done something, let's evaluate what happened. And so I could just, my skill set allows me to take that data and do it. I just don't.
it's a professional choice. That's what
Yeah.
we all make, right? Well, thank you so much. That was really, really interesting, really informative, and I'm sure our participants got a lot out of it.
I hope so. Thank you
yeah.
very much for coming and attending.
Thanks a lot. All right, we'll see everyone next week, I hope. And I forgot to check what our lecture is next week. See, I'm unprepared. Sorry. All right. So see you. Thank you,
Bye-bye.
Professor Friedson.